MSF's Access Campaign has been pushing throughout the pandemic to make sure that any COVID-19 vaccines that hits the market are distributed to people all over the world at an affordable price. Doctors Without Borders is working to make sure that these tools reach everyone who needs them. The organization advocates that medical tools urgently needed to respond to COVID-19 are accessible, affordable and available to all countries equally. For more on the MSF Access Campaign, we are joined via Skype by Candice Sehoma, who's the Access Campaign Advocacy Officer. Thank you so very much for joining us this afternoon on SABC News, ma'am.
Thank you for having me. Thanks, sir.
Now, of course, let's talk about your latest campaign as MSF Access Campaign. This is obviously on the back of struggles by doctors linked to MSF with regards to access of certain things. Take us through the background of this, please.
So the Access Campaign is a small body within Medicine Sans Frontier. The campaign was founded on the principles of making medicine affordable, available and accessible. And in realizing that there are multiple barriers that were preventing and still do prevent access to life-saving medicine, vaccines, as well as diagnostics. So the campaign was set up to respond to this crisis by overcoming this barrier that these barriers that prevent access to medicine. And these barriers range from, your political systems, laws, systematic issues, and that's what the campaign seeks to look into. Some of these systemic barriers that make it so difficult to access these life-saving medical products, as well as stimulating research and development in areas of public health needs.
Yeah. In terms of the COVID-19 pandemic, obviously this has been a little bit more eye-opening as well for MSF, and no doubt, MSF has been on the ground in many countries and for many, many years, but surely there were some lessons as well learned from the COVID-19 pandemic in particular. Explain to us how MSF is advocating for access of these vaccines to address COVID-19.
So MSF, basically, I think we are continuing some of the work that we've been doing throughout in the past 20 years. As I had mentioned, that this work started in the early 2000s when we were fighting for access to life-saving ARVs. And unfortunately, the story hasn't changed much. We're still facing or confronted with the same issues, be it, advocating for patent law reform in South Africa in particular, where the current laws in place still safeguard pharmaceuticals and allow them to actually charge, or rather profiteer from public health. So one of the major things that we've been advocating for is this reform for patent laws, for it to safeguard public health. We've done, stimulating research as well, and ensuring that throughout the research and development pipeline, there's considerations of access provisions that would ensure that, people who are otherwise excluded from healthcare and people who would otherwise not afford access because it's so expensive, because these medical products are so expensive, would sort of get those. So the work that we've been doing during the COVID-19 pandemic is really trying to stimulate, encourage governments to invest into medical research and development in areas of public health needs. So putting money and resources into stimulating research and development, but also changing some of the laws that would ensure access and availability to these life-saving COVID-19 products. As you know, and especially also with the issues around diagnostics, earlier on in the pandemic, we were faced with shortages of testing kits. MSF and various other civil society organizations have been calling for these manufacturers or companies to share their intellectual property to enable other manufacturers to be able to produce the same thing to better respond to the pandemic. In issues of vaccines, we've been calling for equitable access to these vaccines, be it, trying to influence what the WHO's framework when it comes to equitable access, ensuring that international sort of mechanisms like your COVAX facility, that they should in terms of their governance and how they run their institutions, that they should consider your low and the needs of the low and middle income countries. Yeah. So it's really not just looking at the national level, but also looking at the international frame as to how do we ensure that from national as well as international, that such things around access are considered.
Yeah, I'm sure you're aware of the fact that there is a certain distrust about COVID-19 vaccines. I mean, it might not be as big as I might perhaps see it to be. And I wonder how that would impact the work of MSF, and perhaps that also then points to the issue of educating around vaccines. I mean, if there is some kind of a mistrust about the COVID vaccines, which I've seen a lot of conversation about, whether it's on social media or whatever it is, I wonder how MSF is approaching this, because it doesn't seem that people are readily, as was with other maybe diseases or viruses, readily willing to kind of take these vaccines. There's debates and questions around it, and certainly people have a right to ask questions and debate on things that directly impact them. But surely this is also an opportunity for MSF then to also start to not only implement in terms of giving these vaccines, giving out these vaccines and insisting that these vaccines come to where they need to be, but also in terms of educating people about what's going into their bodies, essentially.
No, I totally agree, and I think we are also observing the same in terms of the rise in terms of anti sort of vaccination. And I think it's also just based also on our discussions with other civil society organizations. I think it's continuously being an issue, and for us as MSF, I think we are also ready to give support and to also respond, when there is a need in terms of, the gap on, literacy, vaccine literacy. I think it has been highlighted as a priority for most civil society organizations. And as I say, on the ground, we also partner with a lot of civil society organizations, and probably organizations that will be best placed to offer this literacy. And from MSF, I think we are positioning ourselves also to give support in terms of educating when needed, and supporting various organizations that would otherwise be in the forefront of educating at the community level.
All right, Candice, a great pleasure speaking to you. Thank you very much for giving us this information. Much appreciated.
Thank you.
All right, that is Candice Sehoma joining us via Skype there from the Access Campaign Advocacy Officer from MSF. All right.